Thank you so much. It's a great honor to receive recognition, particularly from an organization and a community that I hold in such high regard. I was attracted to the work of the National Health Care for the Homeless Council for many reasons. The foremost was their commitment to the belief that health care is a human right, and housing is a human right. And together, housing is health care, and that's what we live every day. Now, I've never known a more compassionate, open, and welcoming community in the group of folks that are in this health care for the homeless movement. And as I accept this award, I cannot overstate the fact that none of what I have done, none of the work that we have done together could have been accomplished without the commitment and the dedication and the tireless work of the staff and the consumers of the Colorado Coalition for the Homeless. Many of them are here right now. They are awesome, and they will always be my hero. Give them a hand, please. Now, as Bobby said, I came to this work a little bit differently than most who are here today. I'm not a doctor. I'm not a nurse. I'm not a social worker. I'm really not even an administrator. I came to this work as an attorney who went to law school to learn the tools and the skills to help the social justice movement. I learned social work and community organizing from my wife, Tenley, who unfortunately couldn't be here today. I learned health care from my coworkers, Mary Ann Gleason, and Ed Farrell, and Lisa Thompson, and many others. And I learned housing when I was working in Philadelphia, fighting against redlining and discrimination and fighting for tenant rights. And then I found the Colorado Coalition for the Homeless, and I saw it as a vehicle to bring together all of these elements to address one of the most visible manifestations of poverty, social inequality, and injustice that we have seen in our lifetime, that of homelessness. When I started at the Coalition, we had, some 32 years ago, we had a staff of 6 and a budget of $60,000. Today we have a staff of nearly 600 and a budget of $60 million. We started with a small primary care clinic, the Stout Street Clinic. 2 exam rooms. We had a doc, a nurse practitioner, a social worker, a front desk clerk, and an administrator. And as the number of people on the streets grew needing our services, we started adding more docs and more nurses. And when we were unable to get the mental health community to serve the special needs of our population, we started adding psychiatry and counselors. And when the substance treatment agencies would not meet the needs of our population, we started adding addiction counselors. And when we saw the devastating connection between the oral health and the physical health needs of those living on the streets, we added dentistry. And then we realized very early on that if we only provided quality health care to people and then sent them back onto the streets or under the bridges or even into the shelters, that the likelihood that their health outcomes would improve was very low. So when the housing authorities and the nonprofit housing providers were unwilling to house our people, we started buying housing, and then we started building housing. And so over the last 30 years, we've developed more than 1,900 units of housing that we own and operate and manage. And by the end of this month, we will add 1 new building, 100 apartments, permanent supportive housing, to serve chronically homeless individuals who are cycling in and out of our jails as part of our Denver Social Impact Bond Program. And as Bobby indicated, we were able to complete a 54,000 square foot new health center, the South Street Health Center, with 78 exam and counseling rooms that fully integrates primary care and behavioral health care with dental, vision care, and pharmacy, with a team-based approach to care in a patient-centered medical home. And in addition to that, we were able to build 78 units of permanent supportive housing on the upper floor of that building. So together, this is the model of integrated health and housing that we believe in, that we believe makes a difference in the lives of those we serve, and that we think is the model for creating lasting solutions for homelessness, not just in Denver, but across the country. Now, we operate a supportive residential community in Southeast Colorado that provides recovery-oriented housing with peer supports to 225 chronically homeless individuals who are working on recovery from their addiction and mental health or mental illness. And I recently talked to one of the residents there. His name was Isaiah, and I asked him, "How did you get here?" And he responded with a smirk, "Well, I took the van just like everybody else." But I said, "No, really, what allowed you to take that step to come to Fort Lyon to work on your recovery?" And he responded that after years of living on the streets and living along the South Platte River and meeting our outreach workers from time to time, he woke up one morning and realized that he needed a change. And he said, "I realized I was no longer content with being content with sleeping on the river and hoping that I would wake up the next morning. So the next time the outreach worker came by, I said yes." So I remember that very vividly. He said he was no longer content with being content with his situation. And that's how I feel now, reflecting on 32 years of doing this work. I can no longer remain content of being content to allow things to continue the way that they are. I can no longer remain content being content when too many of our brothers and sisters remain on the streets, under our bridges, and in places that they shouldn't be. And I can no longer be content being content when increasing numbers of mothers and children are sleeping in their cars or sleeping on floors because of the lack of affordable housing. And I can no longer be content being content when too many of our citizens do not have access to the health care they need to survive and to thrive. And I can no longer be content being content when the wealthy and the powerful are no longer just happy to let the poor and the marginalized fall through our shattered safety net, but are actively seeking to further undermine what we have achieved over many years by cutting Medicaid, by cutting Medicare, by cutting Social Security and housing assistance and food stamps. We have come too far to allow this to happen. And I can't continue to be content to being content when our well-meaning friends in Washington seek to ration inadequate resources by creating inefficient systems for targeting resources like coordinated intake and VI SPDATs and time-limited housing subsidies, rather than fighting for the level of resources that we know we need to provide adequate housing and health care for all of our people. So as I reflect on this award and my past work, I'm not yet ready to ride off into the sunset, but I'm getting my saddle ready. As I look out across this room, I see many young faces who are part of the next generation of leadership to fight to end homelessness in our country. As my friend Bob Erlenbush points out, many of you are young enough that you have never known a time when there was not widespread homelessness in our country, and that is a terrible thing. We have to fight back against the idea that homelessness is the new normal. As a white man of privilege, I ask you to join me in standing up and fighting back. Fight back against racism. Fight back against oppression. Fight back against sexism and homophobia and other isms that are contributing to social injustice and the rise of homelessness. Stand up to inequality and the notion that we, in the richest country on this planet, do not have sufficient resources to provide safe housing and health care for all of our people. Stand up with me against the forces who believe that people should be forced to work to receive health care or to receive housing or to receive food. And stand up with me against the notion that we just need to tweak the system to find the next best practice or to follow the next great idea coming from our consultants inside of the Beltway, and all will be well. So it is in this vein that I accept this award in the footsteps of Philip Brickner and Jim O'Connell and John Luzier and my friends Mitch Schneider and Michael Snoops, who are no longer with us. I accept this not as a recognition of past achievements, but as a call to action for new leadership to fight for social justice, to fight against oppression, and to end homelessness once and for all. You are all warriors on the front line of the struggle for social justice. Will you stand with me and fight back? Thank you.